For example, I've come across a lot of complaints about issues being preoccupied with weight, obsessive preoccupation with our obsessive thoughts and ritualistic behaviors. And there are questions asking about what are the relationships and what are the roots of these problems and how to manage them. The first thing we have to keep in mind is that the signs with preoccupation with weight and obsessive washing and obsessive thoughts and obsessive ruminations, which we see in a lot of obsessive compulsive disorders and eating disorders related to each other basically, are not only a focus that we should be concerned about finding and taking care of the problem, but these are the signs and symptoms of other problems that one has to really pay attention to. And if we only concentrate on the issue of, so to speak, all my problems are my weight. So if my weight goes down, all my problems are going to be solved. So that basically the person who focuses only on the weight issue, either in anorexia or in bulimia or in eating disorders, basically there is a weight issue that the patient is preoccupied and is concentrating on. The problem with resolving this condition is that if we just focus on one aspect of our issue, which is in this case the weight issue, and put all our eggs in the basket of the problem with the weight, we would forget about other problems that are surrounding this condition. And basically, unconsciously, we are not able to handle some of our problems that are not tangible and we cannot really touch and we cannot really focus on. So therefore, in eating disorders and obsessive disorders, you see a lot of ritualistic behaviors and focus only on issues related with hand washing, cleaning, issue with regard to weight, because this is the only thing that we have in mind that we might be able to control. However, the first step in treatment of issues relating to eating disorder and obsessive compulsive disorder, according to my opinion, is to look at the unit and say, I have a problem, and my problem are several issues. One of them is weight issue. One of them is hand washing. One of them is thoughts and ruminations. So basically, when we have our outlook into our problems as a complex